Welcome, everyone, to another episode of Rare and Real. I'm Nate Stasko, Vast Therapeutics CEO. And on today's episode, we're going to hear another real story from someone suffering with a rare respiratory disease. We're proud to highlight patient journeys on this interview series. And today's guest, I'm pleased to be joined by Amber Harris, who's living with a rare disease called Primary Ciliary Dyskinesia. And you're going to hear all about that today and Amber's journey. And Amber, thank you for being
Yes.
here.
Thank you for inviting me.
If you want to start off by sharing a little bit from your perspective, what is exactly primary ciliary dyskinesia, or PCD, as we'll refer to it on the rest of the interview?
Okay. Well, it's a mouthful, first of all,
Yeah,
but the primary ciliary dyskinesia, the ciliary are the little hair-like cilia that are in your nasal cavity, your ears, your bronchial tubes, and in your fallopian tubes. And the dyskinesia word means they don't move properly, so they don't do their job to move out the things that they should do. So people who have PCD oftentimes have difficulty with a lot of sneezing and coughing because those hairs aren't doing their job. And then also ear infections. And for me, of course, the most profound is respiratory infections.
yeah. So they can't beat at the right frequency or
Right,
move mucus up out of the lung, and that's
right.
one of their primary functions.
Yes,
Um, so, it's a rare disease, but only approximately 1,500 people each year are diagnosed with primary ciliary
right.
dyskinesia. Can you tell us a little bit about when you were diagnosed with PCD, and so why do you think it's a underdiagnosed disease in the U.S.?
Well, I was not diagnosed until I was 44,
Wow.
and I am 51. So I went through my entire childhood and 20s, 30s, and 40s, beginning of my 40s, being diagnosed as chronic obstructive pulmonary disease or asthma or bronchiectasis, all those umbrella diagnoses. I think for me, the reason it's underdiagnosed is because the doctors, I just don't think that they're as aware of it, of what it is. There's just
Gotcha.
these. I was uh, I was tested so many times for cystic fibrosis because of the fluid in my lungs, and the need for clearance, that it was really frustrating. It was really frustrating because the damage was being done, without the
Right.
diagnosis, my lungs were getting scarred.
Gotcha. So they knew you had problems in the lungs, and even the respiratory specialists maybe weren't aware. And the PCD field has lagged behind the CF, or cystic fibrosis, field for many years, about 20 years
Yes,
behind. The
yes,
genetic testing that is now prevalent for CF was not, or is not, prevalent for PCD. But there are
no,
new genetic tests available now with emerging technology. And so you said you got it at age 44, and all those years of unfortunately lung destruction had occurred prior to being diagnosed.
yes,
Um,
yes. And I
d-
just want to say it was kind of a funny thing. I have adopted children, and my oldest child wanted to take a DNA test, and I took it with him, and we did the health part of it, and that's actually how it came back with markers for PCD and alpha one.
wow,
And
taking it into your own hands.
that's how I took it to my pulmonologist, and that's how I was ultimately diagnosed.
Gotcha. Well, we're aiming to develop therapies at Vast that can address chronic lung diseases, particularly the mucus clearance and the prolonged infections that happen. And we're trying to deliver nitric oxide to help people like you. What would you say? Once you were diagnosed, you think, okay, now we know what the problem is. What are the available treatments? Sort of what went through your head? What was that conversation like with the physicians?
Well, when I was diagnosed, I basically was doing what they had recommended for me, because I was already doing clearance. I was wearing a vest twice a day, doing 4 breathing treatments a day taking oral antibiotics, and so, you know, if I would have been doing, I was doing treatments my whole since I was very young. But I think that if I would have had treatment when I was younger, I probably wouldn't be um, on the transplant list.
Gotcha. So
You
that's
know,
one of the things that I hear that you recently got listed. Can you talk a little bit about overall the journey and then what the lung function looks like when you finally get onto that list? And if you don't mind me asking, what is your current percent lung function for the audience?
okay, so most people are at 100%, 90 or 100%. They start working you up for potential lung transplant if you are around 30%. And I'm at about 20, 22%, depending on how I'm feeling and how much fluid I have in there. And so I was just put on the transplant list June 12th. Um, I've been pre-transplant for almost a year. So we've been holding out, trying to see if I would kind of steady out a little bit and improve. And we've just decided to move forward. The doctors have decided it's the best form of treatment for me.
Gotcha. Well, you have a strong support group in your family and a husband, and
Yes.
we wish you success on that journey and that process. What would
Thank
you
you.
say is the biggest gap in care today? Like, if you could talk to doctors or pharmaceutical companies developing life-saving innovation, what would you tell them for PCD patients is the biggest gap that needs to be addressed?
Um, wow. The biggest gap. I think that the communication with your primary care doctor and them, ruling out asthma, ruling out some of the other issues, and moving forward with testing for PCD, because I think they sit on it for a bit, and maybe the lack of communication with um, with specialists, and not referring them to a pulmonologist from your PCD or from your primary care doctor. I think that's where there's a gap,
Okay.
because that's really where, if you get referred to a pulmonologist and they can test you for it.
So let's talk about the testing. Do you ever remember having gases tested that come out of your nose ever in that process?
I never was, and they just did a blood test for me.
Gotcha. Well, one of the newer things, particularly in pediatric screening, that's being used to screen for PCD is they measure the gas that's coming out of your nose, and your body makes something called nitric oxide,
Mm-hmm.
which is part of normal immune response and kills invading bacteria and fungi. And it actually a gas made by your lungs in your body, and it comes out your nose. And so
Mm-hmm.
today in screening, they measure that gas and they can tell if if you're a PCD patient because they have like almost no nitric oxide being produced. So here you have this really vital molecule for lung function and lung health, and these poor PCD patients aren't making enough that you can
Right.
detect it coming out of their nose. So nasal nitric oxide detection is sort of one of the things that's sort of helping pre-screening. You don't have to get the blood test, and if they suspect it's low, then they move on with the genetic tests that are now available. So
Great.
hopefully, we don't have people that get beyond the age of 18 before the first diagnosis.
That's
And
that's amazing.
yeah. And where VAS comes into this picture is once you do get diagnosed, there are currently no treatments. And like CF, there's no cure for primary ciliary dyskinesia. There are antibiotics to help with the infections and chest treatments that you do and nebulizer therapy, I'm sure. But there's no good medicine for the
No.
actual underlying problem. And that's what we're trying to create at VAST. Um, so, let's talk a little bit more about your pharmaceutical interventions for a second. So you have all the physical tools. What did the doctors use to try to prevent your lung decline from going from 100 down to 20?
Well, I started doing breathing treatments when I was about 5, because I was unable. I had so much stuff in my lungs that it got in the way of me talking and doing things that I needed to do. And so I started doing breathing treatments, bronchodilators, every 4 hours since I was 5.
Right. And
Um, and
bronchodilators would be a traditional, like a meter dose inhaler, right? Like you
I
would see
used a
for asthma.
nebulizer.
Oh,
Yeah, I
you used
used
a
a
nebulizer.
nebulizer. hmm
Gotcha.
Because I wasn't able to suck in with the inhalers, you have to be able to have enough to suck
Force.
it in.
Yeah.
And so I've always used nebulizer treatments. And then my parents percussed my chest twice a day when I was growing up to help me try to cough and clear for my clearance. And then when I got older, I was fitted for a vest, and that helped. And posturing and position, sitting to help with the fluid in my lungs. Um, Antibiotics, prophylactic antibiotics, and then of course antibiotics. Pick for frequent infections, including
Yeah.
pseudosis.
What would you say is the most common infection pathogen that you faced? Do you remember the types of bacteria?
Pseudosis.
Pseudomonas?
Pseudomonas, yeah, Pseudomonas, and I've grown a lot of bacterial and fungal. So nocardia, some because they put me on prednisone. I took prednisone for about 16 years.
Wow.
Uh, High dose prednisone, 40 milligrams, and so yeah, I grew out some pretty interesting bugs.
Yeah. Uh,
Yeah.
and that's one of the things that nitric oxide does naturally. And again,
hmm
CF and PCD patients do not make enough of it,
Right.
as nitric oxide kills those bad bacteria like Pseudomonas. And that's why we're trying to deliver it in a solution, like a nebulized solution, so you can supplement
Wow.
your daily nitric oxide that you're deficient based on your primary ciliary dyskinesia. Um, what would you say again is sort of the greatest need for uh, treatments to stop, the process, to stop the decline?
I mean, I think that awareness is number one. And then I think that clearance, being able to clear out your lungs, it's very difficult once your lungs have scarred to be effective to clearing them. It's almost impossible for me to clear now. But when you're younger, if you can start clearing them out, using your vest and being diligent with that and having a regimen and having treatments and protocol to keep your lungs from that mucus from sitting in there and growing out more stuff. I think that's really crucial to longevity for people with PCD.
Gotcha. And there are emerging genetic therapies that are being developed very early in clinical trials for
Yeah.
PCD, and hopefully one day they might lead to a cure and reverse that dyskinesia that happens in those cilia. Well, you have a great support group around you. Is there anything you would want to share for someone that was recently diagnosed with PCD? That maybe is feeling like, oh my gosh, I have this rare genetic disease. What advice would you have for them?
I would say live your life. Don't be defined by your disease. I feel like I have been able to. I have 5 adopted children, even though I was unable to because of the fertility issues. I have a very full life, pursued careers. I think that really a lot of it is your mindset. I have a strong faith is to just continue your life and be an advocate. If anything, be an advocate so that you can reach out to help other people.
Well, your participation today on the Rare and Real series is definitely speaking your mind and promoting that advocacy that you're talking about. Um, you can count Vast Therapeutics into that support group as you go through a successful lung transplant. We wish you the best, and we'll be
Thank you.
following up on your care. And we hope to bring our therapy to patients with primary ciliary dyskinesia maybe as early as next year. We're on track to complete our phase 1 human trials in the fall, and we'll be looking for patients with bronchiectasis, PCD, cystic fibrosis starting next year as we move into the disease population.
That is extraordinary. It's so exciting. I can't wait to see all the people and hear about all the people that are affected by your treatment.
Thank you. Well, that's about the time that we have today for our interview with Amber Harris. If you're not already following Vast Therapeutics, please follow us at Vast Therapeutics on Instagram, YouTube, and LinkedIn. We also you can visit www.vasttherapeutics.com if you want to learn more about the life-saving innovation that we're trying to pioneer for patients like Amber and others with rare disease. Um, Amber, do you have any final words that you'd like to share with our audience before we depart today?
Sure, I would just say never give up. Keep pushing forward. Just don't let anything get you down. Just keep moving forward.
Gotcha.